Hello, and welcome to Black Health Matters, the podcast that explores the latest issues and trends in health as they relate to the African American community. I'm your host, Daly-Mack, RN, and today we're going to talk about how voting can impact healthcare in underserved communities. Early voting for the primaries started in North Carolina this morning, and we will vote in the presidential election in November. But what many people may not realize is that their vote can have a significant effect on the quality and accessibility of healthcare services in their communities, especially for those who are marginalized, disadvantaged, or discriminated against. In this edition, we'll talk about how voting can make a difference in the health outcomes of underserved populations. We'll also discuss some of the challenges and opportunities that lie ahead for improving healthcare equity and justice in the U.S. So stay tuned and join us for this important and timely conversation on Black Health Matters. Voting is one of the most important and powerful ways that citizens can influence the policies and decisions that affect their lives, including health. By voting, people can elect representatives who share their values and priorities and who can advocate for their interests in the government. For example, voting can determine who gets to appoint judges, who can shape the interpretation and enforcement of laws and regulations related to health. Voting can also determine the allocation of resources and funding for health programs and services, such as Medicaid, Medicare, the Affordable Care Act, and the Centers for Disease Control and Prevention. Voting can also influence the agenda and direction of health research and innovation, which can have implications for the development and dissemination of new treatments and technologies. There are many examples of how voting has shaped the history and evolution of healthcare in the U.S. For instance, in the 1960s, the Civil Rights Movement and the Voting Rights Act mobilized millions of African Americans and other minorities to exercise their right to vote and to demand equal access and opportunity in all aspects of society, including health. As a result, the government passed landmark legislation such as the Social Security Amendments of 1965, which created Medicare and Medicaid, and the Civil Rights Act of 1964, which prohibited discrimination in health facilities that receive federal funding. These laws expanded health coverage and protection for millions of Americans, especially the elderly, the poor, and the marginalized. Another example is the 2008 presidential election, which saw a historic turnout of young minority and female voters and helped elect Barack Obama as the first African American president of the U.S. One of the main achievements of his administration was the passage of the Affordable Care Act, or Obamacare, in 2010, which aimed to provide affordable and comprehensive health insurance to millions of Americans who were uninsured or underinsured. The ACA also introduced reforms and regulations to improve the quality and efficiency of healthcare delivery, such as preventing insurers from denying coverage based on pre-existing conditions, expanding preventive and wellness services, and promoting accountable care organizations and patient-centered medical homes. These are just some of the examples of how voting can have a profound and lasting impact on healthcare in the U.S., and why it is so important for people to exercise their civic duty and voice their opinions. There are also some challenges and opportunities for healthcare in underserved communities, and voting can play a role in addressing them. Underserved communities are those that experience barriers and disparities in accessing and receiving quality and affordable health care due to factors such as race, ethnicity, gender, sexuality, income, geography, immigration status, disability, and more. These communities often suffer from higher rates of chronic diseases such as diabetes, hypertension, asthma, and cancer, as well as higher rates of mortality and morbidity due to lack of prevention, screening, diagnosis, and treatment. These communities also face social and environmental determinants of health, such as poverty, violence, pollution, food insecurity, and housing instability, which affect their health and well-being. Some of the challenges that underserved communities face include inadequate health insurance coverage or lack thereof, which limits access to health services and exposes them to financial hardship and medical debt. Insufficient and unequal distribution of health facilities and providers, especially in rural and inner city areas, which results in long distances, wait times, and transportation costs. Cultural and linguistic barriers and biases, which prevent effective communication and trust between patients and providers, and lead to discrimination and stigma. And lack of representation and participation in health policy and decision making, which leaves their needs and interests unaddressed and unheard. Now, these challenges are not new, but they were exacerbated by the COVID-19 pandemic, which disproportionately affected underserved communities both in terms of health and economic impacts. The pandemic has exposed and widened the gaps and inequities in the health system and has highlighted the urgency and necessity of addressing them. Health care is a human right, and everyone deserves access to quality and affordable health care, regardless of their background, identity, or status. Health care is a social justice issue, and we need to address the root causes and structural factors that create and maintain health disparities and inequities. That's why we must work on and advocate for the number of initiatives and policies that aim to achieve health equity and justice for underserved communities. Some of these include expanding and strengthening public health insurance programs such as Medicaid and Medicare, and supporting a universal single-payer system such as Medicare for All that would cover all Americans and eliminate the role of private insurers, increasing and diversifying the health workforce, especially in underserved areas, and providing incentives and support for health professionals who serve these communities. Enhancing and investing in community-based and culturally competent health services and programs, such as community health centers, mobile clinics, telehealth, and peer support, addressing the social and environmental determinants of health, such as income, education, employment, housing, food, and safety, and ensuring that all communities have access to the resources and opportunities that promote health and well-being, and empowering and engaging underserved communities in health policy and decision-making, and ensuring that their voices and perspectives are heard and respected. Voting can help improve health care in underserved communities in several ways. First, voting can help elect representatives and leaders who share our visions and values and who will fight for our rights and interests in the government. We need to hold them accountable and demand that they enact and implement policies and laws that support and protect our health and well-being. Secondly, voting can help shape the public opinion and discourse on health issues and raise awareness and education among the public and the media. We need to challenge and change the narratives and stereotypes that marginalize and oppress our communities and highlight and celebrate our stories and contributions. Thirdly, voting can help build and strengthen our collective power and solidarity and foster collaboration and coalition among diverse groups and movements. We need to unite and mobilize our communities and join forces with other allies and partners to advocate and organize for health equity and justice. These are just some of the ways that voting can help improve health care in underserved communities, and why I encourage and support members of our and allies to vote and to get involved in the political process. Thank you for tuning in to this special election edition of Black Health Matters. I hope you learned something new and valuable today, and I hope you are inspired and motivated to take action and make a difference in your health and in your community. As I wrap up this edition, I want to remind you that voting is not only a right, but a responsibility and an opportunity. Your vote can have a significant impact on your health and the health of your community, especially if you belong to an underserved population. So please make sure you're registered and ready to vote, make your voice heard, and your vote count. For more information and resources on voting and healthcare, feel free to reach out to me at 252-410-1717. I would love to hear from you. Thanks again for listening, and stay healthy and safe. Until next time, please remember, Black Health matters.